What's up, YouTube? Damon, the dialysis dude. And today I'd like to start a discussion about dry weight. I think I'm going to probably make a couple of videos on this because it's a pretty in-depth subject. In truth, they try to make it seem straightforward, but it's not as straightforward as it seems. So to start with, I'm going to read what they have on the National Kidney Foundation. Well, I guess to preface the National Kidney Foundation, for those of you that don't know what dialysis is, it's what you do when you have kidney failure, and your kidneys control your ability to urinate, to pass fluid. And so when you don't pass fluid, you have to go to dialysis and have the fluid removed. And so the question of how much fluid to remove is a big question. And we have what's called dry weight, and that's the weight that is supposed to be our optimal weight. So that's what I'm talking about for those of you that are not on dialysis. And those of you who are on dialysis, I hope you already have some opinion about this and will have something to respond. But this is the National Kidney Foundation's piece on dry weight, and I'll read it and then respond to that for this video, and then go into more in depth about my personal opinion and the way I run things, because I don't run things the same, but that's how I run things, and everybody has to develop their own opinion. This is meant to start discussion because it's not a cut and dry thing as much as it seems. But on the National Kidney Foundation, they say your normal weight without any extra fluid in your body is called dry weight. Extra fluid can be dangerous and cause extra strain on your body, including your heart and lungs. When you have kidney failure, your body depends on dialysis to rid extra fluid and waste the buildup between treatments. When first starting dialysis, finding your dry weight may take a few treatments. Be sure to tell your dialysis care team if you experience cramping, dizziness, nausea during or after treatment. These symptoms happen if too much fluid is removed or if it is removed too fast. If you have too much extra fluid in your body, you may no longer need more frequent hemodialysis treatments. There is a limit to how much fluid can safely be removed in dialysis treatments. So while that is all true, dialysis is kind of a catch-22 because it has similar effects if you end up too dry. So I think that to start with, there's just basically two different types of patients in the beginning, and then as dialysis progresses, there are also two different types of patients. In the beginning, the two different types of patients are patients that have a history with a medical practitioner of any sort, or have some sort of medical history, that know what's happening to them and have an idea that their kidneys are failing and can start to track their weight as things change. And then you have people like me that just had no idea that was happening until I was almost dead and in the hospital, and then they asked me, why am I not treating my kidney failure? And we're like, kidney failure? I don't know what you're talking about. So for those of us that come into it without really having tracked our weight or previously knowing where we should be in the beginning, you're kind of trying to find your dry weight. And the problem with this for me, and I guess this gets into the other part, when you're as a dialysis patient, there are basically two types of us. The majority of dialysis patients put on fluid and then have to remove as much as they can each treatment, and a fair amount of the time they can't remove as much fluid as they would like because of a blood pressure drop or cramps or something, and so they end up maintaining fluid overload consistently. And then there are people like myself. I still pass some fluid. My function varies depending on my activity level, because my cardio level will change how much my blood can get the fluid to the kidneys, what I'm eating, how much fluid I put on, basically how hard am I stressing what function I have in my kidneys will change my fluid. So I utilize a number of things to maintain things differently. I'll get into another video about how and why I do what I do. But basically, the majority of people just have to try and pull as much fluid as they can. And so there's never really a question of exactly getting dehydrated or getting past dry weight, which I definitely can. And as it says in here, when starting to find your dialysis dry weight, you may feel cramping, dizziness, nauseousness after treatment. I definitely feel that well past my dry weight. And I also will feel that much more if I have a large swing in potassium, and phosphorus can affect things a bit. So it's not always just fluid that will cause these feelings. So it can be a little unsure about where your dry weight will be. And especially if you're a patient that is a little outside the norm that can actually control your fluid and get it down and has a question of where dry weight really should be. For me, when I'm trying to surf performance-wise, if I'm dehydrated, that's a problem. Most patients can't get there though, but I believe you can if you're not. I believe there are methods to get there, and I believe that keep working at it, and I think you'll be able to do it eventually. I truly believe that, and I have had large gains. I have had 4 or 5 kilo gains. I just recently went through a difficulty actually and had a 3.5 kilo gain this last month on my reports. I'm not happy about that. That's too much for me. So on to the next section on the Kidney Foundation. How is dry weight calculated? Your dry weight is measured in kilograms. 1 kilogram is 2.2 pounds. Most hemodialysis patients are advised to limit their weight gain per treatment to no more than 1 kilogram per day, 2.2 pounds, between dialysis sessions. 1 kilogram may not sound like a lot. However, when you think about it as almost 4 to 7 pounds of fluid that needs to be removed, you can start to see how important this is to limit how much fluid you take off between treatments. So if you catch that math doesn't exactly add up, and they're kind of pretty vague there. So for what you normal people don't know about, and if you're new, you'll find out about, and I strongly suggest you're involved, is how we actually find out dry weight, as I put loose basis on it, is by what's called challenging. So we pull off more and more fluid until the patient cramps. And when I'm talking about cramps, they're a bit of a different level. Like some people can cramp and you get some fluid back and they stop cramping. Personally, when I cramp, I'm probably going to get a pulled muscle and it's going to be 10-15 minutes for the fluid to get back in, and I'm going to be in bad pain for quite a while. So challenging is not fun, but the problem with challenging, as I said, is that there's other things involved as far as speed of removal. For example, there is such a thing as a profile. We'll get into another video about that sometime. A profile is being able to change how fast and when you take fluid off. And that's very important for different people because that can be a factor as much as actual dry weight. Your body and symptoms, I guess what I'm really personally trying to say is that you need to be involved in determining your dry weight. You need to be involved in how much they pull off and the whole process. It's just not something that's that straightforward. Again, in the next section, how do I know if I'm at my dry weight? Your blood pressure may be within your normal range after dialysis or before your next session. If you do not experience lightheadedness, cramping between dialysis sessions, if you do not have swelling in your legs, feet, arms, hands, or around your eyes, your breathing is comfortable and easy. So those first two, I just doesn't work with me, at least. We're all different. My blood pressure, I guess maybe if I knew my actual dry weight is what I'm saying, if I knew when I was down too low or not, but it seems like I take fluid off at dialysis and my blood pressure goes up, and then I hold fluid and my blood pressure goes up. So I maybe because I can drop myself down a bit lower than I probably should be. But it's also not necessarily about the exact weight, it's where it's sitting. Like, I still have a little bit of bags under my eyes, but I'm pretty dry right now. So like I was saying about the cardio, getting it moving, and that's the problem with some of the methods that are used to determine dry weight, is that a lot of it is about the fluid movement as much as actually how much is there. And that's where I do agree with the second two parts, where do you not have swelling in your legs, feet, arms, hands, around your eyes? The thing about that is that we get used to what we look like and what we are, and so we don't notice it so much. And as you're breathing comfortable and easy, that again is something that is hard to notice necessarily. For me, I notice it in grumpiness and just general, like, it's a little harder to do stuff. Like if I'm splitting firewood, I can only swing a couple of hits and then take a break instead of actually going for it. Or if I'm surfing, I really got to make sure that I paddle out and take a break out back before I go for a wave. I can't, my range of movement to go get a wave goes way down. But I don't always notice these things until I take some time to pay attention to them. So it's kind of hard, again, to know exactly where dry weight should be for those of us that can control our fluid. And then they go on to methods about how to control your dry weight, which I'm not going to read all of that. It's basically just don't drink fluid, don't eat salt. But the last one is pretty important. It says, what happens if I lose or gain weight? If your weight changes, your dialysis team will adjust your dry weight as needed. Yeah. They're busy. You have way too many patients at the clinic. You need to be involved in that if you think your weight's changing. And again, this comes up to a question for those of us that can control our fluid. What does entail weight change? And that's a pretty in-depth question that I don't totally have the answers to. You got to calculate your food, you got to calculate your fluid, you got to watch your basis. So as far as that goes, I will say that I'm still at a little bit of a loss, even after 15 years, to know when I'm putting on fluid and when I'm putting on food. In general, to be honest with you, I usually don't put on food weight and think that I do, and then go through a process of sweating it off, or I put it on a little bit and then I lose it back down, but I really don't seem to actually gain weight. Sometimes I think I do, and then I realize that I'm dragging around, and then I get a good sweat and I get pushing through the cardio again and working out some more, and I bounce back and I drop the fluid off again. It doesn't really work for me personally to take it off of dialysis. I just yo-yo, I get super thirsty and I come right back and I put it right back up. In my opinions, my cardio level is not moving. It's hard for it to replenish out of the cells back into the blood, and it just is not how it works. As well as when I pulled fluid off of dialysis more, I feel like I lost what kidney function I had. But again, this is meant for discussion. This is not meant for any sort of advice. These are what I do to some extent. This is my response to the Kidney Foundation's information. And I'd like to hear your interest, your input, and how do you deal with your dry weight, and what is your general opinion about how we determine dry weight. Personally, I'm not about challenging. That shit hurts. And I don't feel like I get an accurate response out of it myself. Yeah, let me know what you guys think, and thanks for listening to my ramble. If you got all the way through that, this turned out to be quite a bit longer than I thought, and see, I'll make another dry weight video in a little bit here if we get some interest and people would like it.